What is the status of diagnostic capacity, and what are these facilities that can be in a position to do this, and what is the sort of referral mechanism that we have?
Well, thank you, Sam and Christine, for having us tonight. We are glad that for the first time in our country we are having such a national conversation on an issue which is really key, and it's causing a huge, burden in our community, socially, economically, spiritually, and giving it this immense attention will definitely go a long way to improve, diagnosis of cancer if we cannot prevent. You've asked me a direct question on cancer diagnosis in this country. But before I talk about that, allow me to just mention that the National Cancer Institute of Kenya has this responsibility to coordinate all cancer activities in the country. And it was established because of the huge burden of cancer. We know globally the burden of cancer is quite high, and regionally and nationally, and we can see this even in our communities. And every family is affected. We are all affected. And our country has put in very clear strategies now to address this challenge, looking at it through the entire continuum of care, from prevention to early detection, diagnosis, and treatment. If we look at diagnosis, the question you've asked me, Sam, over the last 10 years, after devolution, there is a lot that has improved in terms of diagnosis in generally for conditions across the country, without talking about cancer, because you present when it is not cancer. You present to the hospital when we are having symptoms that we are not specifically sure that this is cancer. But in the process of the doctors, talking to you, taking that history, examination, all that leads towards diagnosis of cancer before we consider now imaging, which would lead us to know there's a growth, because cancer, predominantly, cancer would begin from mutation, an error in DNA, which is pretty much our genetic makeup.
Right.
And then it grows, it multiplies uncontrollably, excessively, and it has capacity to spread from one point to another. So when it multiplies excessively, then this is when we now see a growth. And this is when symptoms would present, probably pain, probably obstruction of a lumen, right. And someone will present. That is when the doctor now will ask for imaging. And when you ask for a scan, you are likely to now pick there is a growth. So in terms of diagnosis, we have two modalities. You diagnose using what we call pathology, or you diagnose using what we call radiology and imaging. Pathology is where once we have scanned and we found out predominantly most solid tumors. We also have blood cancers that you will not see a growth, but most solid tumors, if you are going to scan and you find there's a growth in the abdomen, in the brain, on the breast, or in your cervix, then that is using X-rays, ultrasounds, CT scans, MRIs, and now PET scans. In our country, the capacity has increased immensely over the last 10 years. And almost every county, through the MES program, almost every county now has increased capacity in diagnosis. We almost have a CT scan in every county. Lately, through our strategies to improve cancer care in our country, we've been doing every county cancer action plan. And we have noticed most counties have CT scans capacity, because that's the basis of diagnosis on radiology and imaging. We have a challenge, though, in pathology. Okay. Where we have very few doctors in that area, and we have very limited equipment and infrastructure. But certainly, there is a lot of improvement.
Okay, and we'll get to that question of the index of suspicion, because it may speak to capacity, especially of the human resource, but also to inform you that this broadcast is in partnership with the National Cancer Institute of Kenya. NCI is an agency under the Ministry of Health that coordinates all cancer activities, from prevention